The big news that's coming out of this press conference today is we're launching the Say Yes COVID test program here in Louisville. So we're launching the Say Yes COVID test here in Louisville. So in Louisville zip codes where we're seeing the greatest concerns with the virus, the Say Yes COVID test program will provide households with access to free, rapid COVID-19 test kits that they can self-administer. So free, rapid, self-administer. The test will be available for the next couple months while supplies last. We'll encourage residents in these neighborhoods to use the free test twice a week, regardless of symptoms, to reduce the spread of COVID-19 and keep the community healthy. Louisville Metro residents in the identified zip codes can order testing kits at covidhometestlouisville.org. We've selected these zip codes for a very clear reason. They're the places with the highest risk of lives lost to the virus. They're also communities where we have focused energy on making sure vaccines are available and will continue that focus. So if you're in one of these zip code areas, there's just more of the virus around you. So you need to do everything you can to get protected. And this testing protocol is part of that. When you think about getting rid of the virus, there is no single solution. And so with the Say Yes program, the idea is simple. Regular testing gives you some peace of mind that you aren't carrying a virus that could be hazardous to your health and a hazard to the health of people that you live with or that you come in contact with. And if you wake up not feeling quite right, you might have a runny nose or a sore throat, you can take a quick, easy at-home test. If you didn't find a virus, that's great news. If you get a positive, you now know and can take steps to take care of yourself by calling our helpline and steps to take care of others by quarantining. So this is a major new test that can be ubiquitous around these neighborhoods. It can be everywhere with the homes, and it's just really easy to take this test. I want to thank and acknowledge the National Institutes of Health, the Centers for Disease Control and Prevention, manufacturer Quidel, healthcare technology company Care Evolution, and of course our public health and wellness team for providing this opportunity. It's a really great thing here for our city. Now, back in early 2020, soon after the pandemic started, our public health team and our healthcare partners got to work setting up sites where people could be tested for COVID-19. Testing obviously has gotten a lot easier since then and has been widely available throughout the community since those early days. And there's no telling how many lives have been saved because of these efforts and efforts from partners like Jefferson County Public Schools. So no matter your zip code, if you've been exposed to the virus or if you're feeling ill, please get tested. If you've got kids in JCPS, it's a good idea to sign them up for free weekly testing so you can have that peace of mind. Now let's hear from Connie Mendel. She's our Assistant Director of Louisville Metro Public Health and Wellness, and she is going to provide us more details. So Connie, welcome. Please tell us how we got this opportunity as a city.
So we're one of 8 cities chosen by the National Institutes of Health and the Centers for Disease Control Prevention to initiate the program. So we were identified based on our very high local infection rates and the public availability of accurate COVID-19 testing and tracking data, and for having the local public health infrastructure to support the project.
Yeah, no, I think that's a real testament to the public health team and overall community effort here that they had confidence that we'd be able to really optimize this program here. So when you talk about the zip codes, maybe you want to go back through that again. I mean, we've been able to, how do we know what zip codes we have the highest infection possibility? And if you want to take us through that.
So, we've been tracking our COVID cases since the beginning of the pandemic. And unfortunately, there aren't enough tests available for every resident over the age of 2 in Jefferson County. But our data has shown that these zip codes have experienced the highest burden of the disease. And they also include people with households with lower incomes, more essential workers, so people that can't work from home. And these zip codes also have the lowest rates of vaccination.
And how about our wastewater analysis?
Also, where we are seeing incidents and evidence of the disease in our wastewater. You're correct.
Okay, and so you've talked to a lot of folks throughout the last 19 months or so. Like, talk about the importance of being able to test at home versus, going to another location.
So, it's interesting. If we go back to the beginning of the pandemic, you couldn't find testing. It was not available. And as you had mentioned, our healthcare systems and here with the health department, we set up a lot of testing available. And now these rapid tests are available, reliable and available at a lot of pharmacies. So these test kits that are available through this program are very similar to those that are sold at local pharmacies. But now that we've got all the kids back in school and the community's opened back up and many people are returning to their pre-COVID lifestyles or similar to that. So we need to determine, when we wake up and we don't feel well or our kids have a cough or a sneeze or a headache or fever, being able to determine quickly if that's COVID and if it is using these at-home kits, then we know to keep our kids home. To protect the other students and staff. We know not to go into work or even attending a social event. So, whether that's a concert or a wedding or even going out to the grocery store, having these test kits at home and being able to do a quick test, it just helps us prevent the spread of the disease into the community.
And Connie, how do the tests work?
So they're a quick nasal swab. So swab in each nostril, and then you swirl that swab into a tube that has a liquid, and then there's a dip. You dip a test strip into that tube after that, and the results are ready in 10 minutes.
All right, so we're gonna have some home science kits, huh?
Yeah, and there are obviously instructions with each kit and an instructional video. So it'll just walk you through it step by step. There also on our website, there's plenty of helpful hints, other sources and contacts to reach out to, and as always, our helpline is available to walk people through the test. But also, the helpline is available for someone to actually help order the test kits if someone doesn't have access to the internet or just has issue that our call takers on the helpline can order those test kits for you.
Okay, and then how many test kits can someone get?
You can get each house code can get 4 kits, which is 8 tests. So it's a total of 8 tests. And so that's enough for you to take 2 tests a week for 4 weeks. And so the test kits can either be ordered online as through our call center, or there's several locations in town where you can pick up those. And I did want to mention that so if someone is using these test kits and they get a positive test result, that means that it's very highly likely that you have COVID-19 and can spread it to others. So then we encourage them to call our helpline, talk to health professionals, get guidance. Obviously, at this point, you need to isolate, even if you don't have symptoms, even if you feel fine. People need to stay home, isolate themselves, wear a mask around others, and avoid sharing household items. And be sure to clean and disinfect. If it's negative, one thing to remember, it may be too soon after you've been exposed to someone. Sometimes it takes 2 to 3 days. So that's why there are multiple tests in the kit, so you can continue to check at home. That's why frequent testing is recommended.
Yeah. Well, that's fantastic. I mean, when you think about where we were at the beginning of this virus and just really not even knowing how all this was going to work out, and now that we're going to be able to flood the market with home test kits in our most impacted areas that we know through the data, through wastewater, we've made a lot of progress here. And let's hope this fall and winter is when we hopefully really put this virus to bed. And if everybody does the right thing with vaccines and testing, we can certainly do that. So thank you, Connie. We appreciate your good work, you and the entire team at the Public Health Department.